Can you imagine waking up every morning with that familiar ache in your lower back, or feeling that sharp pain shoot down your leg as you try to stand up from your chair? For millions of people suffering from compressed spinal discs, herniated discs, or spinal stenosis, this is their daily reality, and there's so much confusion out there about treatment options that people end up making decisions based on myths instead of facts. So let me share what spine specialists actually want you to know about non-surgical spinal decompression. First off, let's be clear about what this treatment actually does. Non-surgical spinal decompression uses controlled traction to create negative pressure within spinal discs, potentially allowing compressed material to retract and reducing pressure on nerves. But here's what's important to understand. This isn't a cure-all for every type of back pain. It specifically addresses nerve compression caused by conditions like herniated discs or spinal narrowing, not muscle strain or inflammatory conditions. So I also must emphatically say this: success rates can be incredibly high with this treatment, but here's the kicker, that success really comes down to two critical factors. First, we have to make sure the patient is actually a good candidate for this type of therapy. Not everyone is, and that's okay. It's not for everyone. And second, and this is huge, the practitioner's skill level and their deep understanding of how the spine actually works makes all the difference in the world. And this is why I can't stress enough how important it is to find someone who's not just trained, but truly expert in this field with decades of experience. You want a practitioner who really understands spinal mechanics inside and out, because that expertise is what separates marginal outcomes from incredible ones. And while some people do report relief from these treatments, the research shows they work best for people with specific nerve compression problems, and the effects may be temporary rather than producing the same long-term structural changes as surgical procedures. What I find encouraging is that modern spine care follows a conservative first approach, trying treatments like chiropractic care, physiotherapy, sometimes meds, and yes, non-surgical decompression before considering surgery, except in cases requiring immediate intervention. The key is an accurate diagnosis through proper imaging and clinical evaluation, plus realistic expectations about outcomes and recovery timelines, and working with qualified spine specialists who can evaluate your specific condition. Non-surgical spinal decompression can be an effective treatment option for the right candidates with specific nerve compression conditions, but success depends on proper patient selection, appropriate expectations, and comprehensive care that may include multiple treatment approaches. So, don't let myths drive your healthcare decisions. Get proper evaluation, ask questions, and make sure you understand what any treatment can and can't do for your specific situation.